There was a press release from the initial reports at the CDC that 19 states had shown a decrease, a reversal and a decrease in childhood obesity. This is newly released, but yet it's great information that the efforts over the last 2 to 3 decades are actually coming to fruition. In the last 2 or 3 decades, we've been pushing the idea about BMI, diabetes, high cholesterol, the need for exercise. Even with the last administration, they changed the education from the pyramid to my plate, which was a shift in thinking. So it's great to hear about the transition. Hopefully this will affect adults soon and other kids in other states as well. The reason I wanted to talk about phentermine is that it is a shortcut to weight loss. It's a prescribed medicine made popular back in the 70s and 80s when it was used in combination and called fen-phen. And back then there were damaging reports that it caused, or chronic use caused, leaky valves of the heart. Later on, and I'm not sure that it was reproducible evidence, but later on it was said that maybe the leaky valves are from some other cause. But regardless, you have to be careful with the use of that medicine in the long run. And the problem I'm seeing with a lot of colleagues now is that they're just prescribing the medicine for appetite suppression for when patients ask for it, but not intervening with getting patients to registered dietitians, getting patients to exercise physiologists or even physical therapists to begin some form of rehabilitation or exercise. I think it's very important to start with those two, but the last is always to consider a counselor or behavioral health to figure out if there is a relationship between food and emotion. I think it always is, and I will always stress the anti-inflammatory lifestyle as being a well-rounded approach to thinking, eating, and activities. So those 3 facets of your life have to be touched on and planned first before getting to the medicines. If you go straight to medicines, then certainly you're going to lose 3 to 5 pounds a week, but it will plateau at one point in time. And the question is, what are you going to do at that time? If you stop the medicines, you're going to gain everything back. If you continue with medicines, you might, in the long run, have problems with high blood pressure, fast heart rate, insomnia, worsening of ADHD, anxiety, so you have to be careful. The doctor should be very careful about who they select to have the medicines. The only time I will use the medicines is if I have a patient that has made the short-term goals of weight loss a priority. If they have everything else into account as far as knowledge for nutrition, how to eat properly, what happens when you appetite suppress in the morning and then hunt for food later on in the daytime or nighttime. It's very important to have a good baseline of knowledge about food and the effects of food on emotion. If you don't, then no way is anybody in my practice getting the medicine. Once the medicine has been, or at least once 12 weeks has passed, there again should be no further medicines unless you have coaches behind you watching and monitoring and reporting back to me. So those folks that I see that are coming into the immediate care center with years of phentermine use, even if it's on an as necessary basis, I do not agree with that. I think it could be dangerous. And I think it is behaviorally addictive, so you have to be very careful. There's other ways to lose weight naturally. There are several supplements that can be used. Chromium picolinate, if used properly. Gymnema sylvestre, if used properly. Even taking care of the emotional turmoil of what goes on to make people hunt for food is very important. And again, counseling, St. John's wort, 5-HTP, the use of proper fiber during the day, breaking down the meals into 6 squares instead of 3, or for my truck drivers, just 1 meal a day, very important. And not taking advantage of, or at least not indulging in high glycemic foods. Those foods that cause us to get that rush that we have after having a high glycemic food or fatty food, we usually feel good for a short time, but also cause you to hunt for food later on. So you have to be knowledgeable about this before diving into any form of phentermine.